Hi, I'm Dr. Kranthi Ragireddy.
Hi, I'm Dr. Maheswari Raja.
My name is Kathy Mohammadi. Today we're talking about breast cancer, how to detect it, and how to prevent it.
There are no specific causes for breast cancer. It mostly seems to be the result of complex interaction between genetic, hormonal, and environmental factors.
Breast cancer is caused by hormonal changes, mutations, genetic factors, environmental factors, and how you actually take care of yourself.
So, breast cancer causes are categorized as modifiable breast cancer risk factors or non-modifiable. Non-modifiable are the ones like increasing age, female sex, family history, certain genetic alterations. And when we come to modifiable risk factors that include obesity, not breastfeeding, not having kids, alcohol use, smoking, etc.
Though we do not screen men, it is possible for men also to get breast cancer, though rare.
So what are the most common signs and symptoms of breast cancer? The most common sign of breast cancer is usually an abnormal imaging, which is the mammogram. However, some women present with symptoms of palpable mass, changes the contour of breast, dimpling of breast skin, nipple discharge, a localized swelling in the armpits, breast pain, etc.
So, self-breast exam no longer recommended by American Cancer Society.
Self-breast exams are not evidence-based these days, but I feel patients know their bodies the best.
Look for any lump, dimpling, breast size changes, any nipple retraction, nipple changes, redness.
For women at higher than average risk, healthcare providers may still offer clinical breast exams along with providing counseling about risks and early detection. For women still menstruating, a breast exam should be performed a few days after her period ends, and for those who are postmenopausal, breast self-exam should be performed on the same day of each month, such as the 1st or 15th day of the month.
Breast exams are usually done by the patient once a month, about 3 to 5 days after their period. They should examine usually in the shower with very light pressure, circular motion all around their breasts. Things that they look for are any lumps, any bumps, any dimpling, any skin changes, any nipple abnormalities, any bleeding or discharge. While self-breast exams are falling out of favor in evidence-based medicine, I still feel people know their bodies best and are the first to feel any abnormality. They can check and bring any concerns to their physician. I think it's absolutely important to detect cancers early if possible. I always explain to patients that we don't screen for all types of cancers. There's very few cancers that we can actually screen for, which means that we check people with absolutely no problems, and it statistically makes sense for us to do that because we detect the cancer early and it makes a difference in that patient's life. 2 simple tests to do that are colonoscopies to screen for colon cancer and mammograms to screen for breast cancer.
Early detection means finding and diagnosing disease earlier than if you waited for symptoms to start. Breast cancer found during screening exams is more likely to be smaller and less likely to spread. The size of breast cancer, how far it has spread, are the most important factors to predict prognosis. According to the American Cancer Society, when a breast cancer is detected early and is a localized stage, the 5-year survival rate is 99%.
Screening is started at age 40 and is actually recommended to do annually and continue on annually, unless you do have a first-degree relative with history of breast cancer. Then you have to start at age 35. Early detection of breast cancer is the key to fight against it and actually survive.
United States Preventative Services Task Force recommends screening mammogram every 2 years for women aged between 40 to 74 years of age.
Mamogram guidelines will depend on which society we follow for screening. For example, American Cancer Society or American College of Obstetrics and Gynecology or U.S. Preventive Task Forces may have different guidelines. Typically, we recommend starting at age 40 and then every 1 to 2 years. If there is a higher risk, such as a strong family history, we may start earlier.
So how to prevent breast cancer? The ways to prevent breast cancers are working on your risk factors like losing weight by increasing physical activity, avoidance of excessive alcohol use, avoidance of smoking, breastfeeding infants, and having regular breast screening exams like mammograms.
It's not possible to prevent breast cancer, but we can certainly work on reducing the risk factors we mentioned, maintaining a healthy weight, eating a wholesome diet, exercising regularly, avoiding alcohol, smoking, and keeping up with self-breast exams and mammograms is what I recommend.
If you follow these steps, we can hopefully together fight against breast cancer and move into the right direction.
We hope this video was helpful. Thank you for watching. Please click on our YouTube channel and watch more videos from our clinicians.
For more educational videos from our clinicians, please check out our YouTube channel.